Hey guys, Jeff Lewis from Lewis Physical Therapy and Sports Rehab here. I want to talk a little bit today about forearm strengthening exercises for pitchers that are either going through some type of UCL rehab, whether it's from a low-grade UCL sprain or to the extent that they've had Tommy John surgery, or for pitchers that are just looking for ways to work on a little bit of forearm strength to potentially protect their UCL. So the UCL, also known by a lot of people as the Tommy John ligament, because that's the ligament that's commonly repaired from that injury, is the main ligament on the inside part of your elbow that stabilizes your elbow during the throwing motion, specifically when you're getting to maximum external rotation into layback. Guys that have UCL issues, everyone presents a little bit differently, but most commonly, guys will have issues accelerating out of that position, out of that layback, maximally externally rotated position there. So the UCL is the biggest, what we call static stabilizer, meaning it's a ligament, it's not a muscle that can contract or anything like that. So that's a static stabilizer. When we look at other structures that support the medial elbow, there's bone, another static stabilizer, but we don't want to rely on bone. That's going to cause us issues as well. It's definitely not a main or secondary stabilizer. The other big stabilizer are the dynamic structures. And by dynamic, we mean muscles. So typically early on in Tommy John or elbow rehab, pitchers, baseball players will be given traditional wrist flexion, extension, some pronation, supination. Again, all of that is good stuff early on in rehab. You have to build the foundation. You have to lay the groundwork somewhere. And that's a good way to make sure you're not overstressing that tissue. However, as we get further away from that early post-op or early rehab phase, we need to make sure that we are strengthening the deep, more supportive structures to the UCL. And that's three specific muscles: the flexor carpi ulnaris, the flexor digitorum superficialis, and the flexor digitorum profundus. So these are three flexors that directly stabilize that UCL and inside part of that elbow. So we want to make sure that exercises that we do isolate those as best as possible. Now, are you going to get other flexors and other muscles to kick on? Yes, but we want to try to best isolate or bias those muscles. Bias is probably a better term for as much as we can. So I want to go over today a couple different exercises that focus on strengthening that flexor digitorum superficialis and profundus. So one of the first movements that we'll do is more finger-based movement. So what I mean by that is we're not keeping a full palm grip throughout the whole movement. If anything, it might move a little bit, but we're moving through that different range of motion. So the first thing that we're going to do is just a finger curl. So I'll have pitchers get in a split stance here, and you're going to let that band, it's pulling me essentially. I'm resting it on the end of my fingers here. So not on my palm, it's on the end of the fingers. And all I'm doing is I'm just using those fingers to curl in. Okay, so again, I'm not going into the palm. My wrist isn't moving. I'm just moving those finger flexors. And you'll see, if you do it on yourself, you'll see some of the smaller muscles on the inside here working versus the larger, more prominent muscles here. So that's the first thing that we're going to do. The next thing we're going to do is that we're then going to turn that into a full wrist curl into two motions. So you're going to be here, you're going to let it out, you're going to curl the fingers, curl the wrists, curl in, and then it's a nice slow 1, 2, 3 going back. So again, a little bit of some eccentric stretch there. So again, finger, palm, curl, 1, 2, 3, back in. Again, finger, palm, curl, 1, 2, 3, back in. So again, those are just two exercises that we'll use. And again, I'm probably going to use that with some type of blood flow restriction training, just so that way we're getting even more of a strength and hypertrophy response to those smaller muscles. But those are two of my go-to strengthening exercises for those deeper forearm flexors that directly stabilize that UCL. So if you have any questions or you're looking for more information or whatnot, check out some of our links below. Comment on the video if there's anything that you liked or had any further questions on for any future videos.